Hello, my name is Ivy Guerra and I am a student nurse at Cedar Crest College School of Nursing. And today I will be talking about reducing catheter-related complications in adults. The PICO question that I will be answering today is, in adults with indwelling urinary catheters, does collaborative protocols such as staff education and patient rounding as compared to standard practices reduce the indwelling catheter days and catheter-associated urinary tract infection rates, also known as CAUTI rates? The significance of this problem has shown that the nursing staff has shown a lack of knowledge when it came to removing the urinary catheters in patients. It had also shown that there had been a potential disapproval from certain healthcare workers, such as physicians, and a lack of support from their peers. Also has shown that collaborative protocols to remove shortened urinary catheters significantly shorten not only the catheterization days, but also shorten the hospital days for the patients. Throughout these nursing discussions with clinical nursing specialists, also known as CNS, rounds had uncovered not only keeping the urinary catheters for the convenience of the nurse and the patients, but also has shown the unawareness of the CAUTI risks and the dependence on the primary medical team for the removal of these incisions. Throughout the process of this literature, I had used two databases in order to collect some more information: the Cumulative Index of Nursing Allied Health Literature and the Google Scholar. Throughout these two databases, I had used certain keywords such as catheter-associated, indwelling urinary, catheter-related, infections, protocols, CAUTIs, and prevention efforts. And this also excluded international articles as well as anything older than 2014. 3 articles were appraised and used to answer my PICO question. And then within these recommendations of these 3 studies, I have learned that the collaboration among nurses, healthcare team workers such as physicians, and hospital leaders really enhance their peer-to-peer education and nurse-driven protocols in order to improve CAUTI rates and as well as the use of urinary catheters. So ideally, they used the integration of external urinary management, such as the PureWick, in order to reduce the CAUTI rates. There has been a successful involvement in these protocols, and it involved mainly with avoiding the unnecessary catheterization, and this also included regular reviews with the certain healthcare teams, in this case our CAUTI teams, to collaborate these efforts with the healthcare providers and to reduce the CAUTI risk and enhance patient safety. In order to reduce CAUTI rates required not only a comprehensive approach, but just encompassing education within the nurses and the patients, and also improving the protocol changes and the multidisciplinary teamwork and active involvement of the CAUTI champions. And these were healthcare folks that really integrated the CAUTI research and really integrated on the best protocols to follow per hospital. In conclusion, it has shown that multi-phase measures not only included a dedicated team and education improvement, but also significantly reduced the amount of catheter days by 19.79% and lowered the CAUTI rates to 38%. By using these protocols, it also had improved the catheter removal and decreased the duration days by 6.7 days to 3.6 days, just by advocating the avoidance of unnecessary catheterization use and alternative interventions like external urinary management devices. The vital role in this collaboration not only included the education and the evidence-based strategies that emphasized by the partnerships across departments to successfully prevent CAUTI clotty rates, but the best evidence to date when reducing clotty rates is to remove the catheter as soon as possible to avoid unnecessary use. And ideally, staff education would be the second best choice to prevent clotty if and only catheter was placed. Thank you so much for listening to my presentation, and I look forward to hearing any questions you have.